these are just some of the common myths, and I hope you've learned something. If three things that I want to pass across is that I think what we need more in this community is education. Education about how we can lower our risks for cancer, breast cancer, other diseases, exercise, alcohol, breastfeeding, a good diet, feeding your own breast, clinical breast exams. Number 2, early detection with yearly mammograms. My understanding is that at the National Hospital, and you can correct me if I'm wrong, my understanding is that a mammogram is about 20,000 naira. So it's not prohibitive, and you can go there, you ask for your doctor to order a mammogram, or go there and get your mammogram. Make sure you get it, if not every year, at least every other year. And then number 3, we need to start thinking about how we can destigmatize cancers. There's a big stigma about cancers in our communities, and I don't know why that is. Because nobody willed cancer on themselves. Nobody caused cancer. You didn't do something bad to get cancer. So I don't know why there's such a negative stigma around cancers. If you have a lump, or you know somebody that has a lump, this is not the time to go into a shell and hide it. This is time that you need to come out. You need to seek medical advice for potentially life-saving treatment. So thank you very much for listening. This is all I had for my presentation. I'm very happy to take any questions that I didn't cover.
Okay, so you said that the underwire bra doesn't cause breast cancer. But I find that personally, when I wear the underwire bra, I have a lot of pain. But when I stop wearing it, I'm better. So I'm not saying I have breast cancer, obviously, but I just want to really understand what's going on. Thank you.
Yes, I found a lump in my breast, and I went to Medicaid, did a mammogram, and they said it was benign and it was not cancer. I'm even with the report. Again, now I became afraid because my sister died of cancer. So I was opportune to travel to India on official assignment, and I just used maybe just some hours. I said, let me go and do mammogram again in India. I went to the general hospital there, Mumbai General Hospital. I did mammogram. I did some other tests, and they said likely malignant. There's nothing like benign again. So I'm still confused, and this is about 3-5 years ago. So, but I'm worried. I'm still worried.
Okay, I'll answer your question first. So the issue with underwire bras, there's no, studies have actually looked at that, and there's no data to support that. So, sometimes underwire bras are uncomfortable. If it doesn't really fit right, they're less comfortable than those that are not underwire. So that may be the reason, but it doesn't mean that it's causing anything, bad. Probably just the comfort. The issue with, conflicting results, conflicting opinions. So, of course, nothing in life is 100%. And remember, it is a human being that is reading the mammogram. And it also depends on the person's expertise. For instance, somebody who is a general radiologist, who is reading ultrasounds, is reading CAT scans, mammograms, MRIs, will have less expertise than somebody who is just reading, who is a breast radiologist, who is reading mammograms every day, 365 days a year. So the expertise differs. But if you have a conflicting results and there's, you're not sure, the next step needs to be a biopsy, because the biopsy is going to determine for sure if this is malignant or not. So that's what you need to do.
We have an adaptation method that we put in place in Nigeria as radiologists because of the dense breast issue under the age of 40. And the younger age of breast cancer occurrence in blacks. Because of that, we actually started from the age of 23 to offer ultrasound as a screening method. added to the clinical breast examination. I want to know what your opinion is on this. I know it's not global best practice, but we need to be culturally sensitive to our limitations. Thank you very much.
Because this has come up, several times in discussions even in the US. For instance, African American black patients also present with these aggressive breast cancers under the age of 40 when they are not yet, due for this to start screening, and we wonder how we can catch these women as well. So ultrasound has been talked about as a potential screening tool for black women. The problem with ultrasounds, again, is that it's user dependent. So it is somebody who is going to, it has to be an expert who is going to do the ultrasound and determine what it is. And that sort of limits its applicability. So kind of just the availability of the expertise is the limiting factor.
I lost my mother and my sister to breast cancer. My mother was 55, my sister was 38. I have an aunt and a cousin, also from my mother's side, with cancer. I've been doing a mammogram for the last 3 years, and I'm going to be 40 this year. And it's very, I don't know, okay, well, I always thought mammograms were dangerous and all of that. Although recently it was suggested that I do the BRCA gene test so that I just get it over with. So what would you suggest for someone like me?
A very strong family history, particularly with people in the family, for a lot of first and second degree relatives, particularly if they have early onset breast cancer developing under the age of 50 or 40, that's certainly worrisome for some sort of genetic predisposition. So, of course, there's the problem of access to genetic testing. It's not available, it's not widely available, if at all, in Nigeria. And in the US, traditionally it had cost several thousands of dollars to get genetic testing done. But there's actually a new company that is doing direct-to-consumer marketing, and that company is called Color Genomics. And the test is just $250, and they actually can send the kits to Nigeria. So what they do is that they send the kits to you if you can pay, and you do a swab. It's a saliva swab, and when you do the saliva swab in your cheek, you can get some DNA material. You put it inside the bottle and send it back to Color Genomics. They will run the BRCA testing and send you back the results. Now, of course, if you have the BRCA mutation, then what are you going to do with the results? So watch their options. If you've completed childbearing, you can consider removing your ovaries. That will decrease your risk of breast cancer. You could consider prophylactic bilateral mastectomy. Of course, not everybody wants to lose their breast, but that is, probably the most powerful strategy. You could consider chemo prevention with a medication called tamoxifen. It's an anti-estrogen. It's very, very well tolerated. Of course, it does have some side effects like hot flashes, night sweats, things like that, but in general, it's well tolerated. That can also decrease the risk of developing breast cancer. And then you can do more intensive screening. So even if you did not have access to the genetic testing, you would be an individual that I would want to screen a little bit closer. So I would absolutely continue your yearly mammograms. I would never miss it. And then if you can, I would probably talk to you about adding on an MRI with the mammogram, something every 6 months. So if you have your mammogram in June, in January, then you can have the MRI in June, and then the next January a mammogram. So something alternating every 6 months, or if that becomes too much of a burden, then you can do both of them once a year. And if you still cannot do or access MRIs, then you need to definitely continue. You need to keep on your mammograms once a year. And of course, be very, very attentive to your breast examination, and if you can access clinical breast examination, that will probably help you as well.
There's this very popular belief that people have around here is that people who use microwave their foods often are at risk. please, would like you to shed more light, because most times people are now afraid of using microwave, you know, and then even when they are using it, somebody will say, cancer, cancer, cancer. As if someone wants to kill themselves.
Microwave and cancer.
Yes. So I think this, in particular, this came from, the idea of radiation causing cancers. Of course, we know that radiation can cause cancers, but there are certain types of radiation. So, for instance, radiation from the sun can cause skin cancer. Radiation to the chest wall can cause breast cancer. These are high doses of radiation. The radiation that a microwave puts out is, very small quantities, and there's no scientific data to support the link between breast cancer and microwave ovens.
Going on right now, a lot of people, virtually everyone, wants to be light complexioned, and so the use of bleaching creams has increased drastically. So I want to know if that's a predisposing factor, the fact that people want to use a lot of bleaching creams.
Really a clotting factor. Vitamin K, deficiency in vitamin K, doesn't have anything really to do with cancer, to be honest with you. That's why in children you see newborn babies get injected with vitamin K. It prevents bleeding. So we give newborn babies vitamin K so that they don't bleed out from the umbilical stump. It doesn't have anything to do with the development of cancers. The second question is about bleaching creams. So bleaching creams have a substance called hydroquinone, which in large quantities, with repeated use day in, day out, certain percentages, I don't exactly know what the concentration is, but definitely is a risk factor for skin cancer.
I came to Abuja because I was diagnosed for stage 3 breast cancer, and then I was referred to National Hospital. I got there on Tuesday and I was booked for 6th of March. And to me, I think that's dangerous because I expect that each second counts, and I was supposed to be allowed to see the specialist. And I'm here waiting. I have to start crying for someone to even help me book for next week, Tuesday. And I can't sleep at night because I know that I need to do another second opinion and start, which scares me. And to me, this is not right at all because to me, it's a sensitive issue. It's supposed to be taken seriously. And I really don't know what to do but wait, which is scary. So for me, I'm saying because I think something the government needs to look into. Because cancer is becoming so much and patients need immediate attention. Thank you so much.
Talk then or after the meeting, but I do agree with you. If you had a diagnosis, some certain cancers need to be treated a little bit sooner than others. Now, having said that, many types of breast cancer, again, I don't really want to have this go in the what I'm not meaning, but there are certain kinds of breast cancers that need to be taken care of very, very quickly. Whereas some breast cancers are slow growing and are not necessarily emergencies. But still, having a diagnosis, one needs to get treatment, get the ball rolling.
Thank you, doctor. My first question is, how dangerous is the mammogram? Because she asked, but I know you said we could have one on a yearly basis. So really, how dangerous is it? And then number 2, the biopsy. I've heard that once you do a biopsy, it now touches, something, maybe the cells. So the division now begins to occur faster. So once you've done a biopsy, if you need to go for that surgery, it better be soon. Then number 3, what is the place of diet in cancer? Because I know that people in the medical field don't hammer on it that much. For instance, I'd expect that for the lady who is waiting, you know, if she can, while she's waiting, if she can do something about her eating habits and the things that she eats, like what your mom eats, the soursop and all of that, you know, that could be something that could keep her going. But I wouldn't hear that advice from the medical field often, you know. And then really, can the natural the herbs, the eating habits and all that, how can you tell us how curative it is? Because we have personal experience, my family and I, you know, I mean, with people who've had cancer and, you know, who've gone that route and fine. So, you know.
Okay, so the last question in terms of, you know, the herbal remedies. You know, some of these herbal remedies, again, you know, I'm traditional medicine is what I practice. So I can speak to what I know has, you know, is proven from testing thousands and thousands, hundreds of thousands of people. So while, you know, I do not frown on people who want to do the non-traditional, you know, other holistic treatments, I still encourage people to go for what I know works, because I've seen many patients go for these non-traditional remedies and come back with widespread metastatic disease, and it failed them, whereas if they had taken care of it with traditional medications, they might have been cured. So, you know, there's some patients that definitely want to do that, and I don't discourage them. What I tell them is that, you know, let's do this first. You know, let's do the surgery, the chemo, radiation, and then once that is all done and you're disease-free, you know, please feel free to continue your traditional medications. And if they will support you, you know, they can support you, but at least they will not interfere or counteract with the medications we will be giving. So I don't discourage them. I just ask that they're not done at the same time as traditional medications. Now, will they work? I mean, I don't know. I don't have any data to support their effectiveness. The second question was diet. Now, I mentioned this in my presentation, that obesity is linked with multiple cancers. Breast cancer, endometrial cancer, cancer of the womb, colon cancer. These are the top 3 cancers that obesity is linked with. So absolutely maintaining a healthy diet with eating properly, you know, less of refined sugars, less carbohydrates, more of proteins, you know, more nuts, more fruits and vegetables. We all know exactly what to eat. You know, all things in moderation. That can also definitely decrease the risk of breast cancer developing. There have been many studies showing that, you know, maintaining a healthy weight also reduces the risk of recurrent disease in people who have been treated for certain cancers, including breast cancer. So we always encourage our patients that even after you've gotten your full treatment, maintaining a healthy weight in some studies is also actually as powerful as the impact of chemotherapy. And then your question about the biopsy. So again, that is not true. Breast biopsies do not cause, you know, biopsying the tumor doesn't cause spread. That's an old wives' tale. The only way to diagnose, you know, cancer is to have a piece of tissue come out and test it in the lab. So if you don't do that and it's a cancer that's in there, ultimately it will grow and spread. So, you know, this is something that doesn't happen. It's an old wives' tale, and I don't really know where it came from. And then you had a question about mammograms. So mammograms are very safe. They're very safe, and they save hundreds of thousands, millions of lives with early diagnosis. Remedies that you mentioned, the garlic, the beetroot, these are good things to eat. These are things that are very good for your cardiovascular system. You know, they're good for health. They're good for health in general. So we do recommend those. But now in terms of those things, eradicating and treating cancers, there is no evidence to support that. But these things are healthy, good lifestyle choices in general.
So everyone is becoming scared. So please do an aluminium foil too, because sometimes when we don't want to cook with the cellophane, we run to the foil, and it appears that both are now risky. Please, what do you have to say about that?
I really don't know. I do not have any opinion about it. But I mean, personally, the one in the leaf is sweeter. So try to go for that.
Risk that, you do not necessarily ask them to stay away from contraceptives, hormonal contraceptives. But then you also advised the lady sitting here that there's this treatment, the prophylactic chemotherapy treatment, tamoxifen, that could be given, and it's an anti-estrogenic medication. So I'm wondering if that's not a bit contradictory, if they can go ahead and use hormonal contraceptives that have estrogen, and then there are certain foods like soya that is very high. They said it's highly stimulatory for it. So I'm wondering if it's not a bit contradictory for them. Can they not be advised to go low on such things and then? Thank you.
The soy foods do contain estrogens. And remember, there are many different kinds of breast cancer. Breast cancer is not just one disease, it's made up of many different kinds. In fact, there are 3 distinct clinical subtypes. So the commonest kind of breast cancer is the one that feeds off estrogens. That happens in about 65% of patients. And when we have patients with this kind of breast cancer that feeds off estrogens, we do not ask them to, stop eating soy completely, but we advise them that all things in moderation. So that's what we tell them. You don't have to do away with soy completely, but all things in moderation. The question about vitamins. Yeah, I don't know of any data that links any particular vitamin to the development of breast cancer. The question about contraceptives. In patients who have this estrogen-fed breast cancers, we advise them not to use hormone-containing oral contraceptives or any hormone-containing contraceptives. They need to use the IUDs that don't contain hormones or, condoms or some other kind of method. Now, for patients who have not developed breast cancer, that recommendation is not there. Now, for patients like this lady who have a high risk of breast cancer, having multiple family members, particularly maybe there's a gene around, it's actually a different kind of breast cancer that's called triple-negative breast cancer that's not hormone-fed, that happens in those individuals. And so for those individuals, hormonal contraceptives are okay. And you ask some other questions which I can't remember. Well, the timing for breast self-examination, so it just needs to be about the same time every month. Usually around the time of the period, the breast changes. So what we would advise is it shouldn't be around the time of the period, maybe around the middle of your cycle, when the breast has sort of gone to its baseline. That would probably be the best time. But having said that, it should be about the same time every month. So it shouldn't be a situation where, this month it's the mid-cycle for you, next month it's when you're having your period, then your breast has changed and it's lumpy, bumpy, then you get worried. So it should be about the same time every month. If it's going to be when your period is, then it needs to always be when your period is. If it's mid-cycle, it always needs to be about mid-cycle for you. So for men, again, we don't recommend screening mammograms for men because the incidence of breast cancer is very low in men. But of course, if there's a man who is known to be at particularly high risk, then breast self-awareness, clinical breast examinations are usually advised. So this cancer awareness program we had today is just to sort of educate the lay public on breast cancer, telling them what the risk factors are, how they can help themselves in do the strategies to reduce the risk of breast cancer, such as eating healthy, exercising. We taught women how to advocate for themselves and access health care, how to examine their breasts, the need for mammograms on a yearly basis. I went through a little bit about the management of early stage breast cancer and answered a lot of questions from the audiences about the common myths about breast cancer. So it was really an education and an awareness building program. Thank you very much. My name is Adebisi.
Thank you.